Okay, so you get your blood test results back, and everyone always talks about cholesterol, right? But there's this other number on there, triglycerides. And honestly, it's just as important, but a lot of people aren't totally sure what it is. So today, we're going to pull back the curtain on this hidden fat in your blood.
So let's get right to it. What exactly is this fat that's just kind of hanging out in your blood? You might be surprised to hear that your body actually makes it and needs it. But, and this is a big but, only up to a point. So in the simplest terms, triglycerides are a type of fat, a lipid, that's just cruising around in your bloodstream. And their main gig? Energy. See, whenever you eat, your body takes all the calories it doesn't need right that second and boom, converts them into triglycerides. Here's a great analogy. Think of it like an energy savings account for your body. Your fat cells? They're the bank. And those triglycerides? That's the cash you're depositing. Then when you're between meals and need a little fuel, your body just makes a quick withdrawal, releasing those triglycerides for energy. It's actually a pretty brilliant system when you think about it. But, just like with any bank account, you can definitely have too much of a good thing. So what happens when you're constantly depositing more calories than your body is actually spending, especially calories from, say, sugary or fatty foods? Well, that energy savings account starts to get a little overstuffed. And that's exactly where the trouble starts. When that account overflows, we're not just talking about numbers on a lab report anymore. We're talking about some serious and often totally silent health risks. So what's the big deal? Well, for starters, having too many triglycerides can lead to the hardening or thickening of your artery walls. That's a direct line to a higher risk of heart attack and stroke. And if your levels get really high, we're talking way up there. They can even trigger something called acute pancreatitis. Trust me, that's a sudden and incredibly painful inflammation of your pancreas you want no part of. And here's the scariest part, honestly. You can't feel high triglycerides. There are no warning signs, no symptoms, usually until it's a really big problem. That's exactly why getting regular blood work is so important. It's literally the only way to catch it if your numbers are starting to creep up into that danger zone. Okay, so let's say you've done the right thing, you've gotten your blood test, and now you're looking at this report. What do all these numbers actually mean for you? All right, first things first. The number you'll see is usually measured in milligrams per deciliter, or mg/dl for short. Your result will be a specific number that puts you into one of a few categories. Now, if there's one number you're going to remember from all this, make it this one, 150. If your triglyceride level is under 150 milligrams per deciliter, that's considered healthy. That's the goal. It's the number you and your doctor are probably shooting for. But let's look at the whole picture here. So under 150 is great. Between 150 and 199, you're in what's called borderline high. Once you hit 200 up to 499, you're officially in the high category. And if you see a number that's 500 or more, that's very high. And it means your risk for those health problems we talked about is way up. Okay, so maybe your number is a little higher than you want it to be. The next question is obvious, right? Why? Let's dig into some of the most common reasons this can happen. Yeah, there's actually a whole range of causes. A lot of it comes down to lifestyle, things like a diet with too much sugar and saturated fat, not getting enough exercise, or carrying extra weight. But it's not always lifestyle. Sometimes it's other things, like certain medical conditions. Think kidney or thyroid problems or diabetes that's not in your control. Even some medications or just plain old genetics can be a major factor. All right, but now for the really good news. This is not a life sentence. High triglycerides are often super responsive to changes. You have a ton of power to bring those numbers back down. So let's talk about how you can take control. Think of this as your personal action plan, and you'll see it pretty much mirrors the causes we just went over. The foundation is all about lifestyle. Eating heart-healthy foods, which really means limiting sugar and saturated fat, getting regular physical activity, and working towards a healthy weight. But don't forget the other stuff. Limiting alcohol, finding ways to manage stress, getting enough sleep, even quitting smoking. Every single one of these is like a powerful tool you can use to get your numbers in a better place. Now look, these lifestyle changes are absolutely the cornerstone, but it's really important to know that for some people, that might not be enough on its own. If your levels are super high or they just aren't budging with these changes, your doctor might also suggest adding a medication to the mix to help get that risk down. That's a conversation you'll definitely want to have with them. At the end of the day, knowledge really is power. Now that you understand what triglycerides are, what those numbers on your report actually mean, and the steps you can take, you are firmly in the driver's seat. Your health is in your hands. So the only question left is, What's your next step going to be?